Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on. Let's get between the sheets. Hey, welcome back to Between the Sheets. I am excited to have you here today to talk about contraception. So yes, this is a sex podcast and we love having sex and we are very sex positive here. Go sex. But some people want to have babies and some people don't. So when you're in the phase of life where you don't want to have a pregnancy come out of your sexual activities, we need contraception. And there's a variety of different types of contraception. So we're going to kind of go through them today and talk about some pros and cons and some statistics and kind of where things are at with contraception. So contraception is the prevention of pregnancy. It's also known as birth control. There's a bunch of different devices, surgeries, medications, and family planning that can go through it. So just a brief overview before we dig in a little bit deeper. We have oral contraceptive pills that can be taken by women. Implants, which are physically inserted. It's like a matchstick size rod. It goes under the skin of a woman's upper arm, and the rod releases the hormones over time and can remain in place for several years depending on the implant. Intrauterine devices are also known as IUDs. These go into the uterus to prevent pregnancy there with or without hormones. Condoms, they are the best protection against sexually transmitted infections, but also very good for preventing pregnancy. Sterilizations, either vasectomy or tubal ligation for women. Fertility awareness, meaning you know your cycle, you're following things. We'll get into what you can follow, but that can be a non-medical way of monitoring for preventing pregnancy or trying to get pregnant. And then there's also emergency contraception. So this can be used after unprotected sex, or if a birth control method fails, emergency contraceptive can be taken for up to 5 days after unprotected sex, and some are available over the counter at your local drugstore. Some of the types of contraception are reversible, others are permanent. The effectiveness of the contraception method is measured by the number of pregnancies per 100 women using that method of birth control per year. So let's break these down a little bit more. Let's start with the permanent sterilization. So for women, this is tubal ligation. Tubal ligation, also known as tying the tubes, it's a surgical procedure that women can undergo. It blocks, clips, or removes the fallopian tubes so that the ovaries cannot connect to the uterus and allow the passage of the ova, the egg. And so it prevents the egg from being fertilized by the sperm. So a surgeon makes a small cut in the abdomen, the belly, if you will, inserts a laparoscope, I guess, and blocks or removes the fallopian tubes. Takes about 30 minutes. There's different types of anesthesia for this, but usually you're put under general, but it can be local or even a spinal if you don't want to go under general. Recovery is typically going home the same day. You're going to be sore for a while. You're going through a lot of abdominal area and layers there, so definitely going to be sore afterwards, but you do get to go home the same day. It's about 99% effective. And it may also lower the risk of ovarian cancer. Reversing it is possible, but only about 50 to 80% of women are able to get pregnant again after they've had a tubal. So the alternative in that situation would be in vitro fertilization. Tubals are safe. They are convenient for women who are certain they don't want to get pregnant again and they don't want to take hormones or a daily pill or something. So that works really well. If you're getting a C-section, sometimes they will be able to do it at the same time, which then decreases the number of surgeries that you would need. So that's a cool thing too. It can also be recommended in some cases where patients are prone to the risk of ovarian cancer. Tubals do not protect against sexually transmitted diseases. The conditions that risk problems after surgery, after the tubal, include diabetes, issues with previous abdominal surgeries, pelvic inflammatory disease, lung disease, and being overweight. So those are all risk factors for problems after the tubal. And then, all right, so some statistics with our tubals. About 1 in 200 women may become pregnant again after a tubal ligation. The chance of pregnancy is highest in the first year after the procedure and decreases with age. There is some regret in some women. So the younger women are more likely to regret sterilization, with the risk of 12 to 20% for women under 30, up to 40% for women under 24. And the risk drops to only 6% for women over the age of 30. So the younger you are, you might regret it. Usually by the time you hit 30 or above, you have a good understanding of whether or not you want a kid. Mortality risk associated with it, because it is surgery, we have to talk about mortality risk. That's the risk of death. That is about 4 per 100,000 procedures. So relatively safe procedure here. Tubal ligations have increased rates in the recent years, especially among younger adults. And, the Women's Health Organization is definitely looking into this and what we can do to help support women to get them the counseling they need beforehand so they don't regret it, but also to make sure that this is an affordable option for women who want it. So the permanent sterilization for men is called a vasectomy. So this is in my world, right? We do these all the time. My docs do, and I get patients ready for them. The vasectomy is a surgical procedure that prevents pregnancy by cutting the tubes that carry the sperm from the testicles. The sperm cannot get from the testicle out the penis, so they cannot cause a pregnancy in a female partner. During a vasectomy, the doctor is going to numb you. You are awake for this procedure. We try not to put you to sleep, although there are some guys who have very big needle phobias that will get put down, but will get put under, I should say, not down. But we do have, the vast majority of our guys are awake. We give them local numbing medicine, so it feels like a bee sting to your balls for about 10 seconds. And then you're numb, and you'll feel them moving around down there, but you shouldn't feel any pain, maybe just some pressure. They're going to make a small incision on one side. They'll pull that vas deferens up. They're going to clip it, clamp it, burn it, put it back in, put a little suture on it, repeat it on the other side. Pretty quick procedure, usually only 10 to 30 minutes. They'll either close with self-dissolving sutures or glue, so you don't have to come back in for a wound check. Chance of infection is very, very minimal with this. Guys do really well as long as they follow directions. You don't want to do too much after this. You want to take it easy for several days. Ice and ibuprofen are your best friends. No sitting in baths, hot tubs, things like that until things are healed up down there. That will help prevent infection. Vasectomy is more than 99% effective at preventing pregnancy. You must get tested. Remember, the vasectomy does not mean you don't have swimmers. You have to go get tested to make sure that the vasectomy was effective. About 1% are not effective. So we do need you to go get tested. A couple different ways for you to get tested. There is going to LabCorp request, where you provide a sample and you bring it in within an hour of having given that sample, and then they test it, and that is usually covered by insurance with whatever your copay would be. And then there are some home tests now. The kit that we use a lot is by a company called Fellow. They have a really cute little sperm whale as their logo, which I think is fantastic. But basically, you buy the kit from us or order it online, or your urologist, wherever you are, and we send it home with you. 3 months after your vasectomy, you provide a sample, you mail it off to them, so you don't have to go into the LabCorp or anything like that. You can do it all from the comfort of your home. The nice thing about Fellow is if you do still have swimmers present, they will continue to test you under that same first purchase price. If you end up having swimmers still positive at the LabCorp request, that's where you're going to have to repeat that sperm analysis, semen analysis, and you will have to pay again the second time whatever your copay is based off of insurance and how many ever your insurance will cover. We usually test you at 3 months. If you still have swimmers, then we test you again at 6 months. If you still have swimmers at 6 months, we talk about either repeating the vasectomy or continuing to use other birth control. But again, vast majority of guys, this works great for. Little side effects, maybe some bruising or pain at the site. Infection and scarring is very rare. There is a 1 to 3% chance that you can get what's called chronic ball pain. Chronic scrotal pain, testicular pain, if you want to be a little bit more professional about it, but we just call it chronic ball pain. It's kind of a dull ache in your scrotum from the guys that I know that have had it. It's kind of like they're more aware of their balls than they used to be. Not really that big of a deal, but it is kind of a nuisance. Vasectomies are intended to be permanent, but you can reverse them. They are expensive to reverse them because that is not covered by insurance. It can be anywhere from $10,000 to $15,000. Where I am, it's around $10,000. So it can be done. It's generally fairly effective. It reconnects the vas deferens to allow the sperm to enter the semen. It takes about 1 to 1.5 hours to do this. It takes a specialty surgeon to do that. I have one surgeon that I work with that does these. 73% of couples get pregnant within 12 months. It does help. It is possible, but you definitely want to talk to a surgeon before making that decision because it's expensive and it may or may not get you what you want. Vasectomies do not protect against STDs. Before the procedure, you really have no prep, maybe no anti-inflammatories or blood thinners for a week or so, depending on your surgeon and which blood thinner you might be on. But it is a pretty easy, straight up surgery. I usually suggest that my guys have a driver, even though they're not put under anesthesia, because if you just had someone working on your balls and you tried to drive home and had to slam on the brakes or something, you might just be a little too timid to do that. So definitely have a driver if you can. Some statistics about vasectomies. There are about 500,000 men in the United States that get a vasectomy every year. The failure rate for vasectomy is very low. Only 1 in 2,000 women get pregnant after their partner has a vasectomy. The early failure rate is 0.3 to 9%, and the late failure rate is 0.04 to 0.08%. Most men rate the pain of a vasectomy as about a 3 out of 10 on a pain scale, and depending on insurance and coverage would depend on the cost, but most insurances cover the vasectomy, just not the reversal. But it's a great option. And, if you do decide to reverse it, it's 73% success rate. The alternative would be a semen extraction or sperm extraction right out of your testicles and using in vitro for that. So moving on to some non-permanent methods. So let's start with oral contraceptive, the birth control pill. A couple different kinds. There is a progesterone and estrogen combination pill. There is a progesterone only, and then there's an extended cycle one. So the combination birth control is a daily medication. It contains 2 hormones, both estrogen and progesterone. There's a bunch of different common brands, and so we won't go over all of those, but it's pretty common. You can pretty much get it anywhere. The combination of the estrogen and progesterone prevents the ovaries from releasing eggs. You take a daily pill for 3 weeks, and then you take a week of placebos that bring on your period. 91% effective with typical use. It does require a prescription. You do have to take it every day. It does not protect against sexually transmitted diseases. Side effects: weight gain is minimal. Usually, menstrual cycles might become regular, lighter, and shorter. You might also have some spotting, some breast tenderness, nausea, or changes in mood. The birth control pills are showing, because they have both estrogen and progesterone, they are showing some protection against ovarian cancer, anemia, pelvic inflammatory disease, and ovarian cysts. So the progesterone-only birth controls are also a daily medication, but they only have progesterone, no estrogen. So you can be prescribed these if you've had side effects from other birth controls, the combination birth controls. Again, there's multiple brands that make these. The progesterone-only birth controls, again, prevent the sperm from reaching the egg. Unlike the combination pill formulas, you take one every single day about the same time every day. Even the pills during your cycle they do have some hormone in them as well. Effectiveness is 91% here also. It does require a prescription. Take it every day. Does not prevent STDs. The hormones are progestin only. Headaches can occur for some people with these. Weight is less likely to be affected. Your menstrual cycle may become irregular, lighter, or shorter. And you might have breast tenderness, spotting, or changes in mood with the progesterone only pill. The extended cycle pill is extended because it only brings a period every 3 months. So you take the full 4 weeks of active pill, and then once every 3 months, instead of taking that 4th week of an active pill, you take a week of placebo. Several brand names again for this one. The combination of estrogen and progestin prevents the ovary from releasing the eggs. You take the pill for 3 months, and then you take a week of placebos to bring on your period. Again, with 91% typical use effectiveness. It does require prescription. You take it every day. Does not prevent against STDs. And it is a combination of estrogen and progestin. Weight is unlikely to be affected. Menstrual changes may reduce to just a few times a year. Also possible to have spotting, breast tenderness, nausea, decreased sex drive, or changes in mood. One of the things that we've heard about over the years is blood clots with oral contraceptive. So it does exist, but it's pretty small. The combined hormonal contraceptives have the risk of a blood clot is 1 in 1,000. The risk is higher for third generation pills because they have different types of estrogen in them. So that is something to consider, especially if you're prone to blood clots. Other factors that can increase the risk of blood clots: obesity, age, inherited or acquired thrombophilia, and antiphospholipid antibodies. So if you know you have some of these things, it might be that you should not use oral contraceptive for you. So there are injectable contraception methods. So this is an injection. Depo-Provera is the one that we know most often. It is progestin-based hormone. It is given as an IM injection, so in your muscle, in the shoulder, every 3 months. It's 99% effective when used correctly. In real world, it's probably closer to 94% is what they're figuring out. The injectable contraceptives do have side effects, including irregular menstrual periods, unpredictable bleeding, especially during the first year of using the shot. Weight gain is significant. Headaches, breast tenderness, mood changes. They certainly do not protect against STIs, and they might be good for people who live in rural areas that it's more difficult to get to the doctor's office frequently or to order medications that get delivered on time. But one thing that we did find out about Depo is long-term use is associated with weakened bones and increased risk of fractures. So it's not something that we want to use for long-term, but it can be really helpful in a short-term situation, maybe with some international travel or something like that you're not going to be able to get reliable mail for your birth control. So we also have topical birth controls. So this is a birth control patch. They are prescription only. They release hormones into the bloodstream that prevent ovulation, and they thicken the cervical mucus. It does not prevent against STIs. There are a couple different ones of them. Then there are prescription only gels. It's called Phexxi. It's a hormone gel that is 86% effective when used within an hour of having sex. It's similar to condoms or spermicide. It can increase the risk of UTIs, especially for people with a history of UTIs. So, hey, ladies with recurrent UTIs, do not use that, okay? Spermicide is a non-hormonal option that comes in many forms: creams, gels, films, foams, and suppositories. They are available over the counter at most drugstores and pharmacies. It can be used by itself or with other birth control methods. You do not want to use a spermicide with sex toys. It can damage the toys. Male birth control gel is a hormonal solution that contains testosterone and a synthetic hormone called nestrone to reduce sperm production. In one of the trials that I looked at had 86% of participants had a decreased sperm count after 15. So not really great, but it is an option that's out there. The vaginal ring is a small flexible ring. It kind of looks like a hairband, if you will, but plastic. It goes inserted into the vagina once a month. You wear it for 3 weeks. You take it out. You get your period the 4th week. It's 91% effective with typical use. It does require a prescription. Like I said, you remove it after 3 weeks, wait a week, and then insert a new one. Does not protect against STIs. It is a combination of both estrogen and progestin. And then the weight is likely to be unaffected. The menstrual changes, may become regular, lighter, and shorter. You might also have a little spotting, breast tenderness, nausea, or changes in mood. It may protect against ovarian cancer, anemia, pelvic inflammatory disease, and ovarian cysts. So there's some good things there too. Moving on to another type of birth control is barrier methods. So barrier contraceptives are methods of birth control that prevent pregnancy by blocking the sperm from reaching the egg. So the most well-known is condoms. You put it over the male penis and it helps keep the ejaculate in the condom versus getting out so that there's no release of ejaculate inside the vagina. They also have female condoms. Both of them can help prevent STIs as well as preventing pregnancy. So they're great options there, especially for safe sex practices. The diaphragm and cervical cap, these do require a prescription. We don't really see them in use a whole lot anymore, but they are available if you can't take any of the other birth control methods and that works well for you. The spermicide that we talked about, foam gel or cream, and then there's also a vaginal sponge. It's a barrier method that keeps the sperm and eggs apart. It basically absorbs the ejaculate, and then you take that out. The barrier methods are generally safe and have few side effects. They are less effective than hormonal birth control. They can be used as needed, and most are available without a prescription, but barrier methods are not as effective as other birth control methods, such as the birth control implant injection or IUDs. So some pros, they're non-hormonal, they're safe to use while breastfeeding, they don't impact pre-existing medical conditions, they help protect against STIs. Some cons, they require consistent and correct use every time you have sex, and they're not as effective as some of the other birth control methods. So what are some statistics about barrier contraceptives? Their effectiveness, male condoms can be up to 98% effective at preventing pregnancy, but the other barrier methods are less, on average, only about 73% effective. 18 to 28 women out of 100 will become pregnant each year while using barrier methods in general. Let's see. The diaphragm is about 94% effective. The sponge is 73% effective for those who have given birth and 88% effective for those who have not. That's because of the cervical changes that happen with giving birth. Cervical cap is also similar, about 94% effective when you use it regularly. Spermicides are only about 70% effective when used alone. For protection against STIs, condoms prevent HIV and other sexually transmitted diseases. Sponges and diaphragms provide greater protection against gonorrhea, trichomonas than condoms do. And then also the cost is obviously a factor here. 40% of low-income women in the United States would use a different contraceptive method if cost were not a factor. All right, so the next topic is intrauterine devices. The intrauterine device, or IUD, is what you'll hear it called a lot, is a small T-shaped device. It's inserted into the uterus to prevent pregnancy. IUDs are long-acting, they are reversible, and they can be effective for 3 to 10 years depending on which one you get. So there are copper IUDs. These are hormone-free IUDs that work by releasing copper ions into the uterus to make it inhospitable to sperm. And then there are hormonal IUDs, where these contain progestin, which is a synthetic version of a hormone progesterone to thicken the cervical mucus and the lining of the uterus so that they can't implant. IUDs are a good option for birth control. They're effective, they are long-lasting, and they are reversible. So that's really helpful for a lot of women who maybe thought about getting a tubal, but they're not sure that they want to make that full commitment. So this gives them more time to think about that without having to take a daily medication. IUDs have some disadvantages. So the insertion's really painful. Has to be done in the office. They're going to tell you to take some Tylenol beforehand, and you're going to cramp and it's going to hurt. And unfortunately, there is no anesthesia that is covered for this or generally provided. So the insertion is painful. Hormonal IUDs can cause irregular vaginal bleeding or spotting. The copper IUDs can make periods heavier and longer. So definitely some cycle changes there. There is no protection from STIs with IUDs. They are highly effective with a failure rate of less than 1% per year. The copper IUD works immediately after insertion, while the hormonal IUDs take about 7 days to start working. IUDs can last for 3 to 10 years, like we said. So the Mirena and the Kyleena IUDs last up to 5 years. The copper IUD lasts up to 10 years. All right. The IUDs for emergency contraceptive. IUDs can be inserted up to 5 days after unprotected sex. The copper IUD is particularly effective for emergency contraceptive, and it has a pregnancy rate of 0.1% when inserted within 5 days of unprotected sex. IUDs are safe to use while breastfeeding. Medications do not stop them from working, but pregnancy with an IUD in place carries risks. I'm sure we've all seen those babies that come out holding the IUD, or the picture of the ultrasound that there's the IUD and there's the baby. So it happens, but it's rare, 1% risk. In the United States, the long-acting reversible contraceptive has been being used since 1995 and has consistently been increasing in popularity since then. And then we also want to talk about emergency contraceptive as a form of birth control that can prevent pregnancy after unprotected sex or a contraceptive failure. Broken condom, forgot to use it, whatever. Emergency contraceptive is most effective when taken within 5 days of unprotected sex. It is best to take it as soon as possible. It works preventing pregnancy by delaying or stopping ovulation and changing the environment in the uterus or the cervix so that sperm can't meet the egg. The most effective forms of emergency contraceptive is the copper IUD, and then others are the emergency contraceptive pill, such as the Plan B that we are all familiar with. And then there's also a combined oral contraceptives that you can give in larger doses that work well. Emergency contraceptive can prevent up to over 95% of pregnancies when taken within the first 5 days. And there are some side effects: nausea, dizziness, tiredness, headaches, tender breasts, abdominal pain, earlier or later period. You can get emergency contraceptive at Planned Parenthood, the local health department, family planning clinic. Some of the drugstores now carry it, like CVS and Walgreens. Depending on where you get it and which one you go with, it may be free or a low cost from Planned Parenthood or your local health department. Over the counter, I think emergency contraceptive currently is about $50 per use. It does not protect against sexually transmitted diseases. Now, let's say you're someone who can't tolerate birth control methods. You have been with your partner for a long time. You don't want to use condoms, and you're just trying to more naturally, without medicine involvement, prevent pregnancy. So this is where fertility awareness methods come into place. And this is identifying when you're fertile during your menstrual cycle and avoiding intercourse during that time frame. So it's known as natural family planning, rhythm planning, or periodic abstinence. There's lots of different names. So you're going to monitor different signs of fertility. So one of those is cervical mucus, the thickness and appearance of the cervical mucus. There are certain tendencies to it that indicate ovulation. So that's when you would take a break. Basal body temperature, taking your temperature every morning with a special thermometer can help identify your fertile days with that change in temperature. And then cycle days, tracking the days of your menstrual cycle, which can help identify your fertile days. This family planning methods are about 77 to 98% effective. They work best when they are used with a partner who also supports the method. And it's a good idea to use a barrier method like a condom when you're first learning how to do this if you are unsure about your fertility. The most common methods, like the cervical mucus method, the basal body temperature, and the Marquette method, which combines tracking cervical mucus and basal body temperature with an electronic monitor that detects hormones in the urine. So there's a couple different ways that you can kind of look at those things. The effectiveness of fertility methods, fertility awareness methods, depend on how consistently and correctly they are used. But, it does go back to that wide range of 77 to 98%. But if you're doing it really, really diligently, you're somewhere in the 95 to 99% effective, with fewer than 1 to 5 women out of 100 that become pregnant in the first year of trying to prevent pregnancy naturally. So not too bad. There's just a lot of different ways to prevent pregnancy if you want to. So there's just kind of a brief overview. You obviously want to talk to your provider about your specific needs, your specific pros and cons, and whether or not you might be at risk of certain complications. Talking with your partner can be really effective. So definitely a bigger conversation here, but hopefully this gives you kind of a good overview and starting point. It's time for my favorite segment of the show, Between the Sheets Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories. I had a friend of mine when we were growing up, we were young adults actually, and she had sex with her boyfriend, long-term boyfriend, but they were still using condoms because they didn't want to be pregnant and she did not want to take birth control. And the condom broke one night. And so they ran to the drugstore and got the emergency contraceptive, and they were able to take that, which was great to prevent pregnancy. She did well with it, except that she said she felt very sick to her stomach, almost like when you're drinking too much and you just have to you just get that constant nauseousness. And she did throw up a few times, but it went away, I think within like 12 hours. And it worked for her. She didn't get pregnant. So that was really good appropriate use of an emergency contraceptive. I had a patient who had gotten his vasectomy, and he came in to see me a few weeks ago because his wife was pregnant. I don't recall off the top of my head if he had gotten his semen analysis done post vasectomy or not, but your wife getting pregnant, as you can imagine, can cause a lot of issues in a marriage. Who was doing what and when and why and how did you get pregnant? I had a vasectomy. So there is that 1% chance, folks, and he is that chance. So we did a semen analysis, and sure enough, there were swimmers. So it is his, and they are working through their trust issues there. But she is carrying a very healthy baby, and he is already signed up for a second vasectomy so that we can make sure that that doesn't happen for him again. They just completely assumed that it worked. And I believe that it was that he hadn't checked, but I can't remember off the top of my head. But he is scheduled for a second vasectomy now. I think one of my favorites is my friend who basically just had to look at her husband to get pregnant. I think both times that they got pregnant within the first month that they were trying. So, first ovulation cycle. And she had been on oral contraceptive for several years. So they weren't sure what to expect. Got pregnant with their first child, the very first cycle. It was very exciting for them because it was their first and they were actively trying. And then their second one, they stopped contraception and they were pregnant within her first cycle again. So that was pretty exciting. So some people's fertility is right there. I know other people who have been on the pill for many years come off and it takes them, a good solid year before they're ovulating normally and can get pregnant. Certainly there are people who can't get pregnant and definitely empathize with you for that. That is not something that I have had to deal with personally, but I've had several friends that have dealt with it, and it's definitely an emotional roller coaster. You have my greatest sympathies for that. So this was just kind of a fun day today for me, talking about the various methods here. Hopefully you took something away from it, and we will see you next time on Between the Sheets. Have a great day. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.